Alright folks, let's have a real conversation today. We're talking about something incredibly important for every man listening, especially if you've celebrated your 40th birthday or are heading that way. I'm talking about your prostate health. This small gland, about the size of a walnut, sits just below your bladder. It might be small, but its impact on your quality of life can be huge. Many men tend to ignore this part of their body until something goes wrong. But we want to change that narrative, starting right now. Being proactive about your prostate health is one of the best investments you can make in your future well-being. As you age, your prostate naturally undergoes changes. Some of these changes are normal, but others can signal potential issues that need addressing. Ignoring these signals is not an option if you want to stay active, vibrant, and in control of your health. By paying attention now, you can significantly reduce your risk of serious complications later on. Let's make sure you're ready for the years ahead, feeling strong and healthy. Now let's talk about one of the most powerful tools you have in your arsenal for maintaining prostate health: regular checkups. I know, nobody loves going to the doctor, but trust me on this one, these visits are absolutely crucial. Think of them as your health surveillance system. They allow your doctor to keep an eye on your prostate and catch any potential problems at their earliest, most treatable stage. For men over 40, and especially those over 50, or with a family history of prostate issues, these checkups are non-negotiable. What exactly happens during a prostate checkup? It's simpler and less intimidating than many men imagine. Your doctor will likely start by asking you questions about your urinary habits, any symptoms you might be experiencing, and your family medical history. Then there are typically two main components to the screening: the prostate-specific antigen, PSA blood test, and the digital rectal exam, DRE. Yes, it can be a bit uncomfortable for a few moments, but it's a quick and very effective way for your doctor to physically feel the prostate for any abnormalities. Early detection dramatically increases the success rates for treating prostate conditions, including prostate cancer. So, schedule that appointment. Take charge, fellas. Let's delve into some of the common issues that can affect the prostate so you're well informed. One of the most frequent conditions, especially as men get older, is benign prostatic hyperplasia, or BPH. That's a fancy term for an enlarged prostate. It's important to know that BPH is not cancer, and it doesn't increase your risk of getting cancer. However, an enlarged prostate can press on the urethra and cause some bothersome urinary symptoms. The symptoms of BPH can include a frequent or urgent need to urinate, especially at night. While these symptoms can be disruptive, the good news is that there are many effective treatments available for BPH. Now let's address the more serious concern: prostate cancer. This is the second most common cancer in men. When detected early, prostate cancer is often highly treatable, and many men go on to live long, healthy lives. Section 4. Red flags, symptoms you shouldn't ignore. Your body often sends signals when something isn't right, and it's crucial to listen to these warnings, especially when it comes to your prostate. Ignoring symptoms can delay diagnosis and treatment, potentially leading to more significant health problems down the road. Many early prostate issues, including early-stage prostate cancer, might not cause any symptoms at all, which is why screening is so important. One common set of symptoms relates to urination. If you notice changes like a frequent urge to urinate, especially waking up multiple times at night, that's a signal. Other symptoms to be mindful of include blood in your urine or semen. This is a definite red flag that requires immediate medical attention. Persistent pain in your lower back, hips, or pelvis could also be related to prostate issues. If you experience any of these changes, make an appointment with your doctor. Section 5. Your action plan for a healthy prostate: lifestyle, detection, and hope. Alright, we've talked about the why, the what, and the when. Now let's focus on the how, your personal action plan for a healthy prostate. The great news is that you have a lot of power to influence your prostate health through your daily choices. Let's start with diet. Aim for a diet rich in fruits, vegetables, and whole grains. Foods high in lycopene like tomatoes and watermelon, and those rich in selenium like Brazil nuts, have shown promise for prostate health. Next up is exercise. Regular physical activity is a game changer for overall health, and your prostate is no exception. Aim for at least 30 minutes of moderate exercise most days of the week. We've emphasized early detection, and it bears repeating. It is your most powerful weapon. Regular checkups, including PSA tests and DREs as recommended by your doctor, are paramount. Finally, I want to leave you with a message of reassurance and a call to action. Taking care of your prostate health is not something to fear. It's something to embrace as part of your overall commitment to a long and healthy life. Make that appointment today.